Hello, good morning, our future colleagues. My name is Aasir Abuelnaga. I'm one of the emergency physician working in the NHS. Our session today will be about GMC registration. So I'm going to give a very brief talk about it. Then I will ask my colleague, Professor Ahmed Nada, and Mr. Ahmed Eissa. So there are several types of GMC registration. The first one, provisional registration, which is not applicable, I assume, to most of you. For registration, which all of us, we need for registration with license to practice, to either move from second year of foundation program, and which is like training program, or we need it if we would like to work in a non-training job, or what's called hospital-based training or trust job. This, for registration, allow the doctor to work in a supervised medical practice in the NHS or even UK private practice. There are another types of registration like specialist registration, which is not applicable to most of you. GB registration, which is the same, not applicable to most of you. And I would like to clarify, because lots of colleagues, when they read the word specialist and they are working specialist in their specialty in their country of residence, and they think they are eligible for this specialist registration, but this is different from the full registration, and it will be explained in another session tomorrow. The same also for GB registration, which some colleagues think it's like anyone who's not specialized yet, he or she thinks they are a general practitioner, but again, this is different type of registration, which require the doctor to be on like specialist register for general practitioner after completing a structured training program. Then I will hand over to my colleague who are going to speak about the different ways of registration. And I would like to hand over to Mr. Ahmed Nada to speak about his own experience in getting registration. Back to you.
Okay, thank you, Doctor. So I'm Ahmed Nada. I'm a surgeon in University Hospital Durham. So I'll speak about registration through the MRCS or the specialty or with the like, you know, the, here they call it, just to make it clear, it's a specialist qualification. So this is under the general GMC registration, but a specialist qualification, which are like the MRCS, MRCPH, and the different fellowships that can be used for this kind of registration. Okay, so to do this registration, you have to do first something called EPIC verification. So EPIC is an organization based in the United States of America to do verification that these degrees are legitimate or are not frauded or are original, okay? And you need to do two verification, one for the final medical diploma, which is MBBCH, and the other one for the qualification, which is MRCS, MRCPH, or whatever. Before that, they did not do this kind of verification for the UK qualification, but now recently they have to do verification for both. Okay, so the first thing is you do an account on the EPIC, and they do like ID check. So they will do a video call to check that you are the person. You'll see they will see your passport, your ID, and after that you have the EPIC account, and you have to pay, I think, $50 for that. And then you start uploading the documents you want to verify, which will be the final medical diploma and the specialist qualification. And you have to pay for each qualification to get verified about $120. For the medical final diploma, usually they accept what they call it, the board, the one that you put it on the wall, the cartoon one, not the normal paper ones. and it should be usually in the native language. So in Egypt, it's Arabic, and you do an official translation, and you send both the translation and the copy of the original cardboard diploma, and they do verification. Some universities ask for fees to do this verification, so you have to check your diploma needs extra money or not. And then you do the qualification verification. So it is the specialist, when you do uploading, it's called specialist qualification. So the special qualification, you have two things. If you have the degree already after 6 months, you can get the official one. Sometimes you won't need to do the GMC quickly, so you don't need to wait. So according to different royal colleges, you get what is called EPIC, to whom it may concern, letter. For the Royal College of Surgeons, you have to pay your full membership fees to get it. And it's a letter saying that you passed your degree and you are now having a membership of the Royal College of Surgeons, and you paid your due annual membership. And so they can do the verification. So after you do the EPIC verification, you have 2 qualifications verified. Then you go for the GMC and you start the process. You can start the process with the OET or without the OET. But if you do it without OET, you get just a provisional registration, and you cannot get a full registration unless you finish your OET. When you do the OET, you have to go on the website of the OET and give permission for the OET to let the GMC to get your OET verified. And the OET address is in Manchester, not in London. So you have to be aware of that. Then you start your application on the GMC, and you put your qualification, and you put your EPIC account, and then you revise it. And I recommend you to revise it a lot of times and make sure that everything is well standard and up to date and very legitimate and clear. And then you press submit. Don't press submit unless you are 100% sure that everything is there, because after you press submit, you'll receive an email from the GMC saying that it is submitted, and you have, since the submission, 1 month to fulfill the criteria and to provide whatever documents they want. Usually the documents they will ask for, it will be the good standing from every country worked in for the last 5 years. So this is good standing. You will need the internship certificate, and according to different things, they will ask for whatever documents they need. And this will be the process to finish the GMC registration accordingly. So this is the route through the membership, okay? And I think now we can go to Mr. Ahmed Eissa. You have a different route to speak about.
Thanks, Dr. Ahmed, and thanks, Dr. Aasir, for such a comprehensive vision about the GMC registration. Just to start with, for those who are not familiar with the term GMC registration, GMC is the body that withhold the license of all doctors in the UK. So you are not allowed to touch a patient in the UK without a GMC registration, not even measuring the blood pressure. So we can only do a clinical attachment to the GMC. So if you are planning to work in the GMC, you have to find a way to register with the GMC. The main ways of registering with the GMC, the one I know, I'm not saying that that's everyone, the one that's everything, sorry. The one I know is the 4 main things are like the PLAB, where you get the part 1 and part 2 of the PLAB, and then an English test, whether IELTS or OET. The second one is the fellowship, or the membership, whichever specialty you are applying for, MRCS, MRCP, MRCUG. So you get the membership exam, and then an English exam, again, English test, whether OET or IELTS, and then you register with GMC. The third one is the MTI, which is the one I applied through, and I will take you through that more. And the fourth one, which is less common nowadays, I think I was discussing that with Dr. Nada the day before yesterday. So it's the double sponsorship scheme program. I think that's an old way of registering, where you can be sponsored by one of the bodies here, whether a university or one of the hospitals, who are allowed to sponsor someone to register with the GMC without going through the other 3 routes. I think you still need to submit the English exam. Now they made it much more easier. In the old days, it was the IELTS exam, which was pain in the neck just to pass it. Now the OET is much more easier, and I think they even removed the limitation, the time limitation, or the validity of the English exam, so you can have it for good. Once you pass it, you have it in hand. Back to the way, so I think in the old days, they were allowing to apply without the English exam if you have been sponsored by one of the bodies, or someone give you a letter that you are exempted. But this is not working anymore after a few incidents with a kind of communication problem that led to a massive medical problem with patients. Anyway, back to the way I used to apply, my own experience with the GMC registration, which is the MTI. MTI is a very useful and handy way of applying to GMC, which is very, I would say, specialty specific, because it means that your Royal College or the Royal College of the specialty you are going to work for is going to sponsor you at the GMC for registration. So as I'm an obstetrician, so my Royal College of Obstetrics and Gynecology was the sponsoring body that sponsored me for this GMC registration. How does it go with the RCOG, with the Royal College of Obstetricians and Gynecologists? So I think every Royal College for different specialties has their own way, or have their own ways of how to apply to the MTI. Some colleges are quite active in running this on a yearly basis. Others may do it very infrequently. So you have to contact the Royal College of the specialty you are planning to work for in the UK and see if they are offering this and when they do that. I'll speak about my experience, which is a RCOG, the Royal College of Obstetricians and Gynecologists. They usually, when I applied in 2014, as far as I remember, they open the time for applying for the MTI, the Medical Training Initiative, late in December, I think mid-December, and they kept it open until I think mid of January, where you apply. So the requirement at that point were at least having 4 years experience in the specialty you're applying for, and you have to submit evidence of that. You have to submit the evidence of passing what they call it FY1 and FY2, which is the years of house officers back in Egypt, similar to that. I'm not sure how is equivalent to other countries, but you have to check that with the Royal College, and you still have to get the English exam, the IELTS or the OET. So these are the 3 main requirements, and we'll add summary free just to get in touch with them if they are willing to get references for yourself. So these are the requirements to apply for the MTI scheme. So as I mentioned, it's opened yearly in December, I think closes by January. You have to check that on the Royal College website, and then you submit the application for all of that. Once you do that, once the deadline of application closes, they start to check the applications they have in the Royal College. So what happens is usually hospitals or trusts in the UK send to the Royal College that we need that number of candidates to fill in some vacant spaces in their trusts or in their hospitals. Then, so like overall of the UK, like for example, like 50 vacant spaces for that position, the MTI scheme, they send the Royal College, we need the 50 candidates. So whichever the number that applied worldwide, like 100 or 200, they apply to the Royal College, and then they start to go through all the applications and pick and try to like shortlisting them, and then long listing them, and then shortlisting them and pick the most suitable ones for the post they have. So you may be eligible by paperwork, but unfortunately you may need to apply for a year, for another year, if you didn't get the chance from the first year. Once they shortlist or get the numbers that they are allocating for these posts, they send, so they allocate each candidate for a different hospital or trust as per the vacant spaces they have. And then you start, that usually happens in March every year. So the deadline or closing of the application is by, I think, January, somewhere in January. And then they offer the job in March, and you start by August, next August. That gives you a 2 years of training, more or less training post. It's not a training number. So the difference between training number, you have, it's like what we call it back in Egypt, niyaba, or where you have a full structured training program. But for the MTI, you just get like 2 years of equivalent years of any phase of the training, like ST1 or 2 or 3 or whatever. Usually they put you as a ST3. ST1, ST2 are the SHO level, which is the junior level. ST3, 4, 5 are the middle grade, which is where like equivalent to registrars in our home in Egypt. So you start as ST3, and during these 2 years, you are supposed to go through the matrix or the training matrix of the Royal College and submit evidence, and then you get an assessment towards the end of each year. So it's a good way, good handy way to get this. It gives you the privilege of GMC registration. It gives you a chance to start having UK experience, and then it makes it much more easier for you to apply for any post later on in the UK. The disadvantage of this, you are being offered what they call it a Tier 5 visa, which does not count toward the UK passport if you are planning to stay longer and get the British nationality. So that doesn't count toward the, so you have to be on Tier 2. So these 2 years of the MTI do not count towards the British passport. The other, so you can't even extend this visa. Once you finish with the Tier 5, you have to leave the country and then apply from outside as a Tier 2 with any other hospital. You don't necessarily need to continue to finish the whole 2 years. Some people may just get the registration and not even to start the job at all. You can then start, once you get the GMC registration in hand, you can apply everywhere. I'm not suggesting you to do that, but you can do that, theoretically speaking. What I did, I started in one hospital for 9 months, which was a bit of difficult experience for me because it was my first UK experience. I wasn't well prepared for that. I found it difficult. It was a very busy hospital. So I wasn't very happy with that experience. So I had to get out of the MTI program, and then I applied on my own for another job in a different place, and I started as a Tier 2 visa. So it's a different way. I mean, it's up to you whether to continue or complete the 2 years of the Tier 5 of the MTI, or just get the registration and apply somewhere else. It's up to you. Again, it's very personal specific, so I leave that decision for you whenever you get the chance. As I mentioned, you may have to apply a year after another because it's very competitive, and now it's much more competitive for the English exam, or the OET exam made it much more easier for those who are planning for that. One more thing I forgot to mention, to apply for the MTI, you have to pass the first part of the MRCG. This is the Royal College of Obstetrician requirement. I'm not sure if it's the same for other specialties or not. Maybe the surgeon needs the first part of the MRCS, but definitely for the Royal College, you have to have the first part of the MRCG in hand. So that was my way of applying to the GMC. As I said, I just completed 9 months and then went out of the MTI program, and then I applied on my own and continued on the Tier 2 visa since then. That's a brief of my way of registering to the GMC. I'm not sure if there is anything else you would like to ask about, or Dr. Aasir or Dr. Nada would like to add for whatever I have said.
Thank you very much, Doctor.
Sorry, Dr. Aasir. As you said, to apply for MTI, you need a post, any qualification higher than the medical diploma. So even for the surgical college, you either have the first part of MRCS, or have, like, they accept the master degree if you have a master degree from Egypt, but you need a higher qualification to apply. You cannot apply with just the basic medical diploma.
Okay, good. Thank you, Dr. Nada. I would like to mention one of the straightforward, relatively easy method to register with the GMC, which is the most suitable to newly graduate doctor, which I'm sure most of you know about it, but in brief, it's called the B-Lab, Professional Linguistic Assessment Board. It's 3 exams. The first one nowadays is the Occupational English Test, which according to the doctors who said for IELTS and OET is much easier. Lab part 1, which is sort of MCQ question at very basic level to the level of a doctor just graduated. Second and final part, which is OSCE, Objective Structure Clinical Examination. Again, it's a very simple exam, which include examination of body system, communication like history taking, and simple procedure like cannula. Thank you. So we got some few questions, and I would like to just reiterate, because I noticed from one of our colleague or the audience disagreed about the fee paid for exam. All of us, our own experience might be going, for example, mine, I just moved to the UK 17 years ago. Things change in life, fee increase, it's never decrease, by the way. And you will find occasionally something we say might be slightly different of the current regulation. This is not something we intend to give you something wrong, but as you know, life change and everything change, especially the GMC keep changing its regulation. Another question, which is one of the very common question about is the work gap. Will the doctor struggle with the registration process? So I would leave it to our expert, Dr. Nada, because he heard about this question and how to solve it a lot. So back to you, Dr. Ahmed.
Okay, so the GMC is asking about the last 5 years while applying. They need to have a continuous medical practice, but definitely there is different circumstances for different people that they have reasons they are not practicing for. So there are some reasons for the gaps are accepted by the GMC, like maternalship or parentship, sometimes like study leaves. So you have to check the GMC website for the gaps that's accepted. And you have to be honest and say that, yes, I have a gap for 6 months, 3 months, whatever, and say the reason for that. I was studying, I was doing a maternalship, I was, whatever, and usually they accept these gaps. So you have to be very honest and give a reason for the gap. This is for the gap. Also, there is one thing that's a common question I'd like just to say, that when you are doing the registration, they ask you that you have to be medically practicing with a license. So a lot of people struggle, especially in Saudi Arabia, when they go, they have to take some time till they get the registration done or to get the license. And when applying to the GMC, they have to prove that this period they did not practice without license. So it's not accepted by the GMC to practice without license. Okay, so this period is either under supervision, and you have to get a proof that you are practicing under supervision and you're not practicing on your own because you don't have a license. And then they have something called the General Form 1 or GNF1, where you have to sign it with the senior consultant or the one in charge, and maybe from the hospital. So you are working at that time under supervision, not fully as a doctor, because you are not allowed anywhere to practice without license. Same goes to Egypt. During the internship, you are doing training. The internship in Egypt is a traineeship, so that's why after you finish the LMTS or the traineeship, you start getting the license, and it's after that. So during the internship, you are not licensed and you are not practicing. You are in training under supervision. So this also have to be very clear. I think there's.
Yeah, thank you very much, Dr. Nada. I got another question about citizenship. Doesn't give any exemption from the OET. I would say the exact answer, I am not sure about it, but from several friends I got who got citizenship, they didn't give them any exemption at all. They went through the same pathway like everyone else. The only benefit of the citizenship, the HR didn't need to apply for any visa or something like that. But still, exam-wise, still the same, as long as they graduated from a university outside the UK. And we got another question. So once we had GMC registration, we start at ST1, or there is other degree to start with. Again, this question, the answer depends on what level of experience. So for example, if a doctor just graduated like a few months ago, actually he'll apply on junior level. And just to clarify it further, generally speaking, in the UK, like assume every other country, there are 3 levels of doctor: junior, middle grade, and consultant. So it doesn't matter really the exact name, which is foundation year 2 or ST1, both are categorized as junior level. Mostly ST1 is applied for a training job, and it's difficult and it's not recommended as well for doctor to come from overseas straight to training job. Ideally, register, get what's called a trust or service job, know the system well, prepare your portfolio well, then apply for training job. Another, yeah.
So this is one important question just for people to understand. So as Dr. Aasir said, there is 3 types of registration in the GMC: general registration, GP registration, specialist registration, specialty. So specialty is for consultant route. And if you have it, you can be a consultant and get a permanent job as a consultant. GP, you have to finish the training in UK to be a GP. For the general, as Dr. Aasir was just saying, so you get the GMC registration as general. You can start with this GMC as FY1, just without any experience. And you can work as a locum consultant with the same general GMC registration. And in the middle, you can work as a registrar. So all this gives you the chance to work at any level according to your experience. But you cannot get a full-time permanent job as a consultant, but you can work as a locum consultant with the general GMC. So it's a general GMC for all type of jobs, starting from ST1 or FY1 till up to a consultant. Okay.
Okay, thank you. Another question, which I'm going to leave it to our expert, Dr. Ahmed Amir. One of colleague in the audience asking, does Egyptian fellowship or Arab board have any significance when you apply for MTI? He explained a bit further, like a substitute of the master degree. So back to you, Dr. Ahmed Amir.
Thanks, Dr. Aasir. So master degree is not a requirement to apply for the MTI, for at least for the Royal College of Obstetricians and Gynecologists. The only thing that you need as a qualification is the first part of the MRCOG. I don't think any other qualification will exempt you from this part of the requirement. However, I've heard that some royal colleges, like a colleague of mine who got the Egyptian, I think, Egyptian fellowship in GB, I think they have a kind of merge or a deal between the Egyptian fellowship for GB and the GB register here, that it gives them a certificate, but I'm not sure if this is, I don't think this even allows them to work as a GP here. So my friend got a qualification or a printed certificate from the Royal College of GB here that he is having a kind of equivalent certificate, but he can't work as a GB here unless he like finishes the training of the GB in the UK. So you have to be very careful and check the requirement for the Royal College that you are applying for. So the requirement is different between different Royal Colleges of different specialities. But for the MRCOG, I don't think any other qualification so far as far as I know. It's much better to check with the Royal College that it will exempt you from the first part of MRCG. Masters is not required for the MTI scheme.
Thank you very much. Another, I would say, important question, but unfortunately, no one knows the answer except the GMC. The question about when BLAB will be changed to UKMLA, GMC only knows. So I would advise, please keep watching or observing the GMC website to give you exact date about the change. Bearing in mind, like everything in life, especially in the UK, when they change, let us say August 2023, there will be like a grace period where they allow whoever prepared on the BLAB system might be given chance to complete or finish it within, say, for example, 6 months from starting the UKMLA. Second part of the question about how is it going to affect the preparation? Again, I would assume, because I have seen changes of the name of the exam in the UK since I moved to the UK, usually principles are the same: to be competent in English language. Again, whatever its name, it will be exam about medical knowledge. So generally speaking, keep your language skills good and general medical knowledge to be up to date. Another question: what is the best way for GMC registration for a 2-year experienced otolaryngologist in Egypt? It is MRCS or BLAB? Again, this is a very good question, and we hear it a lot. Let me put it this way. BLAB is quicker, easier, and straightforward. But nowadays, or actually before the COVID pandemic, there is a bit of waiting long list to get places. So this might cause some delay. But hopefully, if there are no delay on the waiting list to sit for BLAB 2, for example, it might take 1 year of hard work to clear the 3 parts: language and the BLAB 1 and BLAB 2. MRCS, I'm not surgeon, so I would leave the assessment or the answer to Dr. Ahmed Nada to answer from his experience. Is MRCS really that quick to finish before BLAB, or takes longer than BLAB? Back to you, Dr. Ahmed Nada.
As you said about BLAB, Dr. Aasir, I totally agree. So the thing is, it used to be the fastest way is just do BLAB, and it's in 8 months, 9 months, you can just have a GMC and start working. But according to the COVID rules and the spaces, this is a problem. The second problem with BLAB, we've seen a lot of colleagues facing, is to get a visa to get the examination for BLAB 2. You have to have the BLAB 2 in UK and you need a visa. So sometimes people have a problem to get that. So the MRCS, you don't need that, because you can do all the MRCS in Egypt, the 2 parts or whatever, and you don't have to come to UK. You don't need a visa to do it. The second thing, for the career development, if you're going and continuing in a surgical pathway, so you will need to go for the MRCS. So instead of taking the BLAB and then taking the MRCS and then taking the FRCS, it's better to skip one step, not going for the BLAB and go for the MRCS. Before that, they didn't have it like a prerequisite to go for the FRCS, but recently, to go for the FRCS, you have to have your MRCS. This is a new update. So if it is a mandatory step, so it's better to take it and just skip the BLAB and save time and save money and save everything. For getting ready for the MRCS, it's definitely better if you have surgical experience, but I know a lot of colleagues that just did it after finishing the internship. So it depends about how you are studying, how you are preparing, but definitely it's one step forward if you are going to continue as a surgical career. And even sometimes now, due to the conditions in the lab and unavailable places, people go for MRCS to do the registration for GMC, and then they go for medicine, go for GP training, go for psychiatry, go for anything. They just have it for the GMC registration, which is accepted.
Thank you. The next question, which Dr. Ahmed Eissa will be the best to answer it. One of our colleagues in the audience asking about the Arab word, like would it be helpful in the MTI? Or support him?
Yeah, I think it's quite similar to the previous question about the Egyptian fellowship. I know that the Arab board and even the Saudi board have a similar exam structure for the MRCG, at least where I work with, like this, my specialty, but I'm not sure if they will acknowledge that as a substitute for the Part 1 MRCG to apply for the MRC. I don't think so, because one of the main tasks of the MTI scheme, it allows you to get 2 years of experience. So you have to have the Part 1 MRCG, and they even ask you, or it's one of the prerequisites that you didn't finish the MRCG. So if you finish the MRCG, you can't apply even for the MTI. So and the idea behind that is just the idea of offering the MTI scheme helps overseas candidate to get some UK experience to help them to finish the membership exam. So you have to be on the pathway of getting the membership exam. So you got the first part, and the same time you didn't finish the membership exam. So you didn't get the MRCG part 3. That means that you still need this experience, to finish the membership exam. So this is the main idea of offering the MTI scheme. This is why Part 1 is one of the prerequisites to apply. Unless if they have changed something since I applied in 2014, and this is something easy, can be checked on the Royal College website for each specialty.
Thank you very much. Another question, how many years of experience are needed for GMC registration with MRCS? Again, this is not a job application. We need GMC registration to get licensed to practice. So I might have 30 years of experience, for example, but I prefer to go for PLAB or to go with the membership. So number of years of experience doesn't matter for sake of registration. And I hope this answer helped answering the question. Another question, which I would leave it to Dr. Ahmed Nada and Dr. Ahmed Eissa, because it's a combination about if there is work gap, would it cause problem when try to register via MTI? So Dr. Ahmed Eissa?
Okay, that's fine. I think, as Dr. Nada mentioned before, the Royal College and the GMC in general in UK, they accept the gaps in experience in your CV if they are justified enough, like maternity or any other like particular. As even the UK candidates, they go out of the program for particular things like doing masters or traveling somewhere to do like overseas job somewhere. But in general, it's accepted if you could justify them. For the MTI in particular, as far as I remember, you have to be actively working over the last year or 2 years. So they ask for 4 years, but yeah, so those 4 years can be spread all over your experience, but at least the last year, I think, year or 2, you should be still actively working.
2 years, Dr. Ahmed, 2 years, and even clinical attachment are not accepted. So to apply for MTI route, because I checked that. So if you are the last 2 years, you have to be full practice without even clinical attachment. If you take a clinical attachment for 1 month, you are not eligible for MTI. I'm speaking about the general surgery route. So it's,
I think it's the same for the MRCG, as far as I remember. Yes, you're absolutely right.
Okay, good. Thank you very much. Another question, which good question. I heard about it previously a lot of time, but I think it will be answered in the following session. One of the doctor asking, she is a PhD student in pathology and asking what the best way to start a career. So this will be appropriately answered in the following session about job hunting and starting career in the UK.
And they have to check the Royal College of Pathology because they have a special route and totally different. So for pathology, especially, check the Royal College of Pathology. I have a lot of discussions about this with friends, and the only clear data is on the Royal College of Pathology.
Good, thank you. Another question is the work in my private clinic for 5 years acceptable to register in the GMC? My honest answer, I don't know. So I would leave it to my respected colleagues to answer this question if possible, please.
The problem it can be accepted, but you need two things. The first thing is you need a good standing, so from the syndicate, and then you will need an official experience letter. So the official experience letter, I don't know how to do it if you are going to give it to yourself. This is a question. So I don't know about this, but if you are working for a private clinic for another one, they can give you this letter of experience, but that you are on your own, I don't know. But you can get the good standing. I don't know if you can do it an experience letter and get it signed from the syndicate or not. You need to send to the GMC better to ask them clearly.
All right, great. Thank you very much. So we are approaching the end of this session. So I would like to start with thanking Dr. Ahmed Eissa and Dr. Ahmed Nada for volunteering to prepare this session. Also, I'd like to thank our friends and colleagues in the union, Egyptian Together Union, for supporting and facilitating this session. Also, I'd like to thank the audience for listening to us, and sorry if one of your question we couldn't answer it the way you wanted to know. And please carry on attending the rest of the session, and your feedback will be very appreciated. Thank you very much. See you soon, and hopefully we meet you in the UK when you register with the GMC and you work with us. Hoping to see you soon. Thank you.